Right, let's get started. Good morning, everyone, and welcome. I'm really excited to have you here this morning for our very first speaker series this year. It's Do I Still Need This Medication? Deprescribing and the Safe Use of Medication with Dr. Camille Gagnon. And this morning, she's going to be assisted by a pharmacy student, Nadine Salhi. Let's begin this morning with a land acknowledgement. District 23 is situated on the ancestral traditional territories of many nations, including the Wendat, Anishinaabe, Haudenosaunee, Chippewa, and the Mississaugas of the Credit. We recognize that this territory is covered by the Upper Canada Treaties and is now home to many diverse First Nations, Inuit, and Métis peoples, as well as urban Indigenous communities in our district. A few rules of engagement prior to handing the floor over to Dr. Gagnon. Mute your microphones during the presentation and when not speaking to minimize background noise. Listen respectfully and with kindness while others are speaking. There will be an opportunity for questions at the end of the presentation. Raise your hands to ask questions and wait to be called upon. The chat box will be open during the presentation, and you may use it to ask questions or make comments, and I'll relay those to Camille towards the end. It is my pleasure to introduce Dr. Camille Gagnon this morning. Camille holds a master's degree in public health from the University of Montreal School of Public Health. She is a clinical pharmacist and works with collaborative family practice teams in Ottawa and Montreal. It is through this experience that she developed a passion for geriatrics and for deprescribing. Camille has experienced working in community pharmacies and as a clinical program manager in the private insurance industry. She has also taught pharmacology to future pharmacy technicians. In addition, Dr. Gagnon is the Assistant Director of the Canadian Medication Appropriateness and Deprescribing Network. Based at the Research Center of the University of Montreal Geriatrics Institute, the Canadian Medication Appropriateness and Describing Network's mission is to promote the safe and appropriate use of medication and to improve access to safer drug and non-drug therapies. Welcome, Dr. Camille Gagnon.
Why, thank you so much, Anna, for this very kind and complete introduction and for the land acknowledgement. I will start off by sharing my slides so that we're all set and everything. Please do let me know if you're not seeing the slides right now. I think you should be able to see them. Amazing. Yeah, thank you so much for this invitation. Our organization has a long-standing relationship with the RTO, ERO. I'll tell you, yes. And our relationship spans, as I said, many years, including an opportunity in the past, I believe, to present to the same group some years ago. And I'm just excited to continue on with, sharing information and also hearing today. Our goal really is to provide information and tools for you as an individual, but also as someone who may care for someone, or just in terms of just in general information that may be useful to help, prevent medication harm and prevent medication overuse, which is our mission. And we're really proud to work with the RTO-ERO for all these years with this mission in hand, which is to really promote health. So our title, Do I Still Need This Medication, really emphasizes what we'd like you to ask yourself in terms of your own, as I said, medication or someone else you'd be caring for. And we'll talk about deprescribing, a newish kind of word. It's in our title. It sparks attention for sure. But then the goal really is to understand the concept overall. We'd like to dissect this presentation into three broad questions, three broad themes that will help us navigate through all the way to something very concrete, very practical. So I know teachers are super savvy of, presenting to various groups. Teachers like to read, teachers like to, learn about so many things. So I'll try to make sure the level of my presentation really meets the different appetites. But if you have, follow-up questions after, or feel free, maybe we won't have the time to cover it all in an hour. And, some of you may be well, already versed in this field, but I do hope that there will be one, pearl of information that will be new to you today, or a tool that you'll find useful for you to help educate others, because I know teachers continue to educate throughout their whole life. So the first theme that we'll kind of cover really is explaining why an aging body, an aging person becomes more sensitive to the effects of medications, which in itself is something that we probably know or are somewhat familiar with, or could be new as well, but also just explaining what the underlying phenomenon, the mechanisms explaining it. We'll also then go over to the actual phenomenon that we're observing, and in where a lot of individuals unfortunately are taking medications where the harms actually outweigh their benefits, and identifying what can happen in this case. And finally, the last part, as I said, is practical. What can we do as a society, as patients, as caregivers? It is important for us to acknowledge that this presentation has been made possible through a financial contribution from Health Canada, but that the views expressed herein do not necessarily represent the views of Health Canada. It's a moment for me to share that our network is funded, as you see here, by public funds, which means that there are no specific conflicts of interest to declare. You may use the information provided today or not, but I'm not here to sell. There is no direct conflict there. So why take medications is a good, starting point, just to reflect on their benefits, what they've brought to our society today. We know that, Western world citizens, and live longer than ever, in great part due to medications. And we can only think of, the use of antibiotics, which have changed our way of treating a number of infections and have now saved a number of lives. So medications bring in a lot of benefits and are essential they're a key to the armamentum of resources a clinician, or when we think of a doctor, but also any other health provider, use when treating to improve health. We also like to bring forward other reasons why patients take medications today. So I talked about the first point here, curing disease, but then the second point is actually more a reflection of what Canada looks like today. What medications actually serve now in Canada, in most cases, is actually to treat chronic conditions. When we look at the way that meds are claimed with, overall use in terms of sheer number, I'm not talking about cost, I'm talking about sheer number of users, managing a chronic condition really comes up in the list. I've listed examples here like diabetes, high blood pressure. I'm sure you can think of many other chronic conditions that are common and for which we use medications. These medications have just changed completely the way we approach controlling conditions and preventing complications. The third point may sound perhaps not as important as the ones above, but in fact, we should not diminish the impact of medications, the impact they've had on quality of life. Medications can help relieve symptoms in a number of ways. We've identified pain and fever. Now, taking a medication to relieve a headache likely won't make my life longer in number of days, or, if it's just, just something like that's going to go away by itself anyways, but it will allow me to function. It will allow me to enjoy life a little bit more. It will allow me to work if I need to, or, be with my relatives, etc. So the medications have an important impact on improving quality of life, and not only a quantity of life, which is the approach today to any type of geriatric, just care in general, but especially when we look at geriatric care, where the quality is more important when we survey older adults than the quantity. And then I've said before, we're living longer than ever, in great part due to medication. So medications are very beneficial. And that's why we always stop here and pause. And I'm sure it's clear to you, but our goal is not for you to stop all your meds after this talk. The goal really is about questioning and engaging in your care. But stopping medications abruptly can lead to many other consequences, which we want to avoid without, so the goal is really to, seek information and ask, really. So why all the fuss? Why am I here? Of course, medicines brought so much good to our world, but we are in some ways concerned because we're noticing that there is a phenomenon of that we're going to describe right after, of overuse and risk. When we look at sheer numbers in terms of how many meds are being used, I will present a few statistics to start so we're all on the same page. I'm taking Canadian-wide statistics here, looking at the percentage of people who are 65 and older and who live at home. So I'm not including long-term care residents in the statistics. So what percentage of people who are 65 and older who live at home take at least 5 prescription medications? If you want to use the chat and try out a guess, you're more than welcome. You can think about your entourage, like people around you, your neighbors, your family, and how common that would be in your mind in terms of people who are not who are living at home in the community. Do want to flag here that this does not include those over-the-counter products, those vitamins. That is not part of the statistics. So I'll let you think a couple more seconds before I will unravel the results. 62%. So 3 out of 5 actually take 5 or more prescription medications. Now let's go to a number a bit higher, actually double, 10 or more prescription medications. We're talking about the same population, 65 and above, and now taking 10 or more. Well, it's about 1 in 4, so 24%. Those statistics are dated 2021. The last statistic that I want to show is, I'm not so focused on the number here, although it's interesting in itself, but more so on the trend. What percentage of people age 85 and over? Now we're 20, in the older age group than before. What percentage of these individuals take at least 10 prescription medications? The question here would be, considering that life expectancy for women, I believe is around 84 in Canada, men is 82. So we likely have individuals here that, they've lived past the average lifespan, so are probably healthier. Would we think that they take more or less medicine than their younger group in the 65 and to 84 approximately, and it's more. So so as we age, the trend does show that even among the older adult group, you will tend to increase the number of prescription products you're exposed to. And that's 2 out of 5. So that's it for statistics, but in terms of med use, but it's also good for us to also remind that these are just numbers, of course, to keep in mind, but that the health of older adults is far from monolithical. It varies a lot. When surveyed, over 90% of older adults report living independently in the community. 56%, more than half, report being in good health. But even with 75 to 80% who do live with one or more chronic conditions. So taking medicine does not mean and it does not necessarily say what your capacity is. It is one number to just keep in mind, and we know that older adults volunteer, work, take care of family members, or contribute to society in so many ways. And then we also acknowledge that the diversity, especially in Canada, of ethnic and cultural community members makes it that there is a broad range of norms and beliefs around medication use that we have to acknowledge for when we are developing interventions or sharing information on medications. That may influence the way you approach a prescription. So we have, about 60% of folks taking at least 5 prescription medications, about 1/4 taking at least 10. Let's just keep that in mind, and our numbers increase as we age. Why are we, preoccupied by this phenomenon of what we, it's not non-neglectable, those number of medicines? Well, the fact is that as we get older, as the first point has already been covered, we do need to take more medications often to manage chronic conditions. It's really driven by that. We can explain this by giving a simple example of someone with diabetes. Upon diagnosis of diabetes, we can expect you will be taught, hopefully told, discussed, there will be discussions around physical exercise, but also nutrition, just healthy lifestyle to help you manage your diabetes. But also it is likely, not necessarily every time, but likely that a medication will be started, often metformin. As your condition evolves, say you're diagnosed at 66 with diabetes, at age 82, with the same individual having still diabetes, we may now have maybe 3 medications for the control of blood glucose. That is because the condition did evolve over time. And so aging, the body aging itself and the conditions evolving tend to lead to a higher number of medications. And then benefits and risk change. This is one, say, important piece of the presentation, really describing why the changes in the body really affect the way medications then impact us. And we will highlight 3 important changes that are linked with age. You may see some of the organs there that will, of course, give you some cues. The first and likely most important organ we have in the body, the brain, is affected. Our brain is sealed. We would like it to be exposed to as little as possible in terms of external aggressors. We're thinking about viruses, pathogens, we're thinking about bacteria, but also medications. There are medications that we don't want to go in our brain. We don't want medications to affect the brain because they're not really aimed for that. So the brain is protected by a barrier we call the blood-brain barrier. But with age, this barrier becomes more permeable, which leads to more exposure to medicines. I'll give you an example of why this could be an issue. A lot of we're exposed with age. A lot of women, but also men, but mostly women, use medications for urinary incontinence. So the bladder becomes overactive and spastic. So we'll give medications to calm these spasms in the bladder. These medications aren't really specific. We'd like it to go just to the bladder. But what happens when you take a medication? You take a pill, it goes in your stomach, it's absorbed, and then it goes into your bloodstream. And then we're hoping that this this active agent will link to the right receptor, right, where we need it to go. Hence, we don't want it to go in the brain, but with the barrier being more permeable with aging, this medication that's actually intended to work on your bladder, and it will also have some sort of what we call side effects and affect your brain. And that means in some cases, drowsiness, sleepiness, but also confusion. So it is how we end up by giving someone a medication for an overactive spastic bladder. We end up creating confusion because the medication penetrated in the neurons in the brain. So first off, and it can happen at all ages, but we're more vulnerable, we're more susceptible to that with age. The second point is just linked to normal physiological changes as well. And we all know that unfortunately, as we age, it is a bit harder to maintain a muscle mass. We have to work, and that's where all those exercises are super important to maintain and to avoid being sarcopenic or muscle mass is lesser. So as we age, we tend to, on the opposite, accumulate more fat. Now, a lot of medicines actually love fat, they tend to accumulate in the fat cells and linger and stay there. Why is that an issue? Well, when we test out medicines, we're not intending for medications to stay in the body for a super long time in all cases. In some cases, it could be interesting, but let's say we are taking a medication that is going to put us to sleep, calm our nerves, make us just a little more, calm stress, well, or sleep. If it's the medication is acting for 5, 6, 7 hours, I guess, that's what people are looking for a good night's sleep. But then we'll get back to that. But say you're using this and the medication lingers in your body. We see that in older adults, a lot of medications that are intended, that I just described, can stay in the body 12, 15, 18 hours, where the medication just lingered in the fat. It accumulates. Very problematic if you need to drive a car the next day. And then the last one, I'm sure that you saw the organs on the image there, kidney and liver, very important. And I believe if, out of all of those changes, of course, the two first ones are very important, but changes in liver function plateaus at, about age 39, 40, and there's nothing we can do about it, but it's gradually going to reduce thereafter. And it can be affected furthermore in terms of kidney function by disease. So if you have diabetes, some, current hypertension, other conditions that can affect the kidneys, your kidney function can actually, be reduced more dramatically. But with age, it just reduces gradually, and we do need to adjust. So Nadine, as a pharmacy student here, and we're all taught in pharmacy school, how do we adjust medications? Age, we'll have to consider that because of kidney function, out of many other factors. So the plant that's clearing out, of course, everything that comes in our body, the water plant of our body is not functioning as efficiently with time, and so we'll have to adjust because medicines just stay longer in the body. And then the liver, do want to say that it's important, but it's less frequent that we have to adjust for liver function. Liver function usually, unless someone has a clear condition, such as hepatitis due to specific viruses, or of course, excessive consumption of alcohol, but there are a number of other conditions that can affect the liver, but those are maybe common ones. In general, the liver will be able to, it won't be a huge impact on the way meds affect us, clinically speaking. But for people with specific conditions, we do have to adjust. So that's a, thick, important slide, I'd say, in our message. But these are, important concepts to understand, to really underlie, really support everything that comes later in terms of our message related to harms of medications. And when we look at the populations in society that are most exposed, most at risk of experiencing harm from their medications. First group, people over age 65, well, you won't be surprised. I've just described in quite lengthy terms why that is the case. The second group are people with multiple chronic conditions. That can be, it's kind of logical in a way. You'd say, well, of course, they're taking more meds. But when we look at just the fact that chronic conditions are affecting the body itself, it makes it that we are less prone, less, able to get back to equilibrium or homeostasis for those the science teachers in the group. So back to equilibrium, meaning if a medication, just a simple example, is reducing our blood pressure too much, we would be, in a lot of cases, someone with a cardiovascular system that is functioning appropriately would be able to adjust and increase back the blood pressure to ensure that it doesn't drop too much. But someone with a chronic condition affecting those systems would not be able to compensate. And that's where a fall, a syncope can happen. The last group is women. And it's quite shocking, right? But we know that women have been, excluded from studies historically for valid reasons. Pregnancy, of course, is the one that comes to mind. But then we understand as well that women are more exposed to side effects of medications due to their physiology. And the next slide explains it here. So women are smaller, women's kidneys are smaller, women have more fat in their bodies. And so these biologic factors end up affecting the way the medicines also affect the body. And then women report more health conditions or prescribe more medications as well, just due to behaviorally associated to gender. For example, there'll be less stigma or anxious to talk about anxiety or depression to their health provider. This brings more medicine. So all in all, you're in here with both higher risk in terms of biology, but also more exposure. And we do, as a network, do want to raise awareness and raise a flag in saying that all of the populations that I've identified here, when we look at drug trials, in a lot of cases, we will omit maybe all three of these groups, maybe one of them, or we'll have just a small subset of patients. Because as a drug company, if I am testing a medication, it is not in my advantage for someone to end up in the hospital because of my medication, right? So I do want to have patients or, trialists that are robust. That is in my advantage. So the issue with the way that medications have been tested for a long time is that we will take patients for my diabetes medication. Let's make sure that their renal function isn't too low. Let's make sure that they don't have, a number of psychiatric conditions on the side that will make that it's hard for them to adhere to their therapy, et cetera, et cetera. So the way medications are tested ends up excluding populations in which later on we will use the same medications. So these are just valid questions that need to be asked, and bring in this aspect of raising awareness and on the fact that sometimes they're approved, but have they been really tested in the people that were actually using it? So I'll pause here. I see like a small set of folks, but I'm just wanting to make sure everything's fine. Is this the level of information you're kind of you're happy with? And okay, I see some nodding. If we'll have some time at the end, of course, for questions. But if ever I'm either talking too fast or, just mention it. And I do see Mikey mentioning antihistamines in seniors. Perfect, Mickey. I'll get back to that at the end because it's an excellent point, a category of medications that we can actually address later, specifically in the section. So I'll move forward. Medication overload, or what we may also call polypharmacy. So we've quoted it two terms to make it, something also in lay terms is medication overload, but polypharmacy may be a word that you've seen before. What is medication overload? Medication overload is taking a combination of medications that brings more harm than good. Now, I do want to say that you can be in a medication overload situation with just one. So it's not just the sheer number, it's also the quality. And someone taking a medication that's causing them harm is already in a situation where it's too many, it's too much. As you'll see here, the harms of medication overload are multifold. They include falls and fractures, issues with memory, cognition day to day, but also acutely, such as causing delirium, more so in older patients. Interactions between medications is a concern. Of course, most interactions usually happen early on in a treatment, but it is not always the case. As a pharmacist, I think it's something that we do want to kind of raise awareness about more, is that your body can also change and interactions can become more clinically significant even if you've been on the same meds for a certain time. And there could be accumulation, etc. And hospitalizations are a result of polypharmacy and medication overload. What numbers do we have? Well, this study just gave us a portrait and estimated. They looked at older adults in the hospital, and they identified that in about 10% of cases, 6 to 12%, so I'd say 1 out of 10, a side effect was involved or causing the side effect. And when they dove in and they looked at in terms of what happened in terms of this side effect, they did identify that over half could have been avoided. And then also really comparing what had been, identified by the clinical teams and what had happened, that a lot went undetected. So I just want to just say, the burden of polypharmacy is real. And the work that we're doing really is to, because of the fact that our attention is really focused furthermore on disease and on, where we may forget that. And I'd like to quote here someone from the Australian Pharmaceutical Society, their past CEO, who said that if medication harm was identified and really flagged really every time coherently and identified, then it would be really leading in the cause of issues. It would be up there with, cancer societies, Alzheimer's societies. I'm not here to compete, of course, but we're just saying here that it's unfortunately it doesn't get a lot of press because it's often unreported, but it's there. It's something that we're seeing. I can take a question from Mickey if you want to unmute yourself. We're not hearing you, Mickey, so I'll keep going and we'll do this later. We'll keep your question. We'll do it later. Just don't want to. Okay, so the other aspect of medication overload. Oh, there you go. Hi, Mickey.
Sorry, I had some technical difficulties there. I'll talk fast. I love that photo of the pyramid of bottles, the medication. And
yes,
as you're talking, no, yeah, that one. As you're talking, I'm overwhelmed and I'm also shocked. What are we doing to seniors? This is nonsense. I mean, there's societies where they say, walk, meditate, eat better food. Like, I am just shocked at this picture. And it is so true.
Yeah, thank you for these comments, Mickey. And of course, we're starting with facts, and I'll end with, solutions, because not all is, dark. And the access, as you're saying, to alternatives to support health is, of course, a big part of this in terms of lifestyle and socialization, as we're here today to, meet and connect, etc. So I'll get into solutions, because I think it's also important to say that not everything is, but there is, of course, a problem. That's why we're here to really describe it. And thank you, Mickey. Medication overload and polypharmacy, we're also concerned because it has an impact on just sheer the aspect of taking your meds. So you can reflect on your own, if you take medications, how constant, how good you, how consistent you are with taking your doses. Say it's once a day or more, so sometimes it's 3 or 4 times a day in some cases. How challenging that can be. So if we reckon that some patients take 5, 10, or more medications, we know how challenging that can be. And the issue is that then we are adjusting medications or increasing doses where patients are necessarily taking all of the medicine. Meaning there may be a use of a dose that is unnecessarily high. That is caused by the fact that we are either missing doses, but there could also be the issue of taking too many meds and that causing confusion and doubling, for example, doses by mistake. Important for us to talk about other products. It's not just a prescription drug story. Do you take natural health products or over-the-counter medications? A Health Canada survey showed that it was about 80% of people who used a product in the last months, which is higher than ever. But I'd like to remind everyone that, at this point, that these products are not benign. They can interact. They can have side effects themselves. So not because they don't require a prescription that they are benign. And we talked about antihistamines. I think it was Mickey who mentioned that. Antihistamines are used for a variety of things, a very old molecule in some cases. So the first generation antihistamines, things like Benadryl, things like chlortriptyline, things like for allergies, have been used for a long time, and they have a lot of side effects. They cause dry mouth, confusion. In older adults, they can spark the, really memory issues. They are used for both allergies, but also sleep, to tell you just how much their effects are broad. And they're over the counter. That's the point, is that it's not benign. And also in Canada now, every time we give a presentation, or almost, there's someone talking about cannabis. And, we do have to address that topic, and also recognizing that some folks may use other products that are non-prescription to, in a way, self-medicate, like alcohol. And these products also interact with medications and cause a lot of harms. So the opioid crisis is, of course, all up in our minds there as an important public health crisis. And the combination of medications and with opioids, but not only with sedatives, with sleeping pills, etc., can lead to very serious consequences. And so that is also part of our message, in terms of it's more than just medication. It's people taking medication, but with other things as well. So very important for us to raise that point. So as I said before, medication overload is not just a thing of number, it's also a thing of quality of prescriptions. In the clinicians' world, in health sciences, there is a list of medication that is published, which identifies medications that in most cases should not be used in older adults. It's called the Beers list, in honor of Mark Beers, the geriatrician who created this list in 1991. And then there has been many new iterations of this list. That's just one example. There are more lists. That's an American version. There's a European version as well. But the lists identify risky medications. The definition of a risky product or medication is that the risks outweigh the benefits, but also that a safer alternative exists. Because if it's the only thing out there to help someone, then of course we're looking at this a bit differently. And I'm sure you're looking for an example. I've named that product maybe a few times. About 1 in 10 Canadians use sleeping pills. For us, it's really a big part of our message, raising awareness on the fact that sleeping pills are actually risky meds. They affect our brain in so many ways, right? We take it affects our short-term memory, it affects our reaction time, it affects the way we plan. It has an impact on more than just putting our brain to sleep, but it's also affecting our functioning. And often not just during a few hours, it affects us the next day as well. And we know they're risky because when we look at the big, vast data of population who take sleeping pills, their benefit in terms of sleep is marginal. People tend to then increase their dose because they develop a certain form of tolerance to it. And they increase the risks that we see of very harmful effects, such as falls, fractures, and issues with memory, and also car accidents. Car accidents being across the ages, not only older adults. So, very high consequences to meds that are very common. And as I said, sleeping pills are risky because there are alternatives. And in the case of sleeping pills, this safer alternative, which is recommended as first line for insomnia, is called sleep therapy, or CBTI, cognitive behavioral therapy for insomnia. It's a non-medication approach. It is comprised of 5 components, and looking at things like those recurrent thoughts that we may have when we go to bed, sleep hygiene. We're just retraining our body or brain to sleep really naturally, and associating the bed to sleep. And as I said, it's first line, but it does take a bit more, effort and time to put in place than taking a sleeping pill. But it works better, and it works for a longer duration. So to Mickey's point in terms of accessing those approaches that are effective, but that may not, rely on medicines. But we know as well that older adults take risky medications all too commonly, and not just sleeping pills here. It's 38% of men in Canada who have at least one prescription that's considered risky, and about half of women. So they're very common. So there's many things we can do to improve the prescribing practices. Furthermore, we spend money for these meds. That means, harms. That means, of course, paying for the meds themselves, but also further down the line consequences in terms of loss of independence and hospitalizations. But the $1 billion per year is only fixed, basing itself on the cost of the meds, not those health consequences of the meds. Finally, we're also concerned about the impact of medicines that are unused or just medicines in general on the environment. So recognizing that if we're disposing of medicines in water, it's contaminating, of course, but also just through our urine and stool. I mean, it ends up in the environment in a way or another. And we've heard stories of fish exposed to antidepressants and hormones, and it caused for loss of biodiversity. And just the production of a medication. So there's a big movement in terms of reducing the impact of the healthcare on the environment, because it's huge. And deprescribing, which is what I'm getting to, is seen as an active, valuable solution. Because if we don't need a medication, maybe that's the best way to reduce our footprint there for it. If furthermore, if it's even harmful to us. So I'll give an example of someone who would be in a medication overload situation. Fiona, 69 years old, has felt a little lightheaded lately. She gets up in the morning, she feels energyless. She's had 2 near falls in the past month, but doesn't really told anyone because she's caught herself on furniture. She feels anxious now about going outside and going out for coffee. And she does take medication for diabetes and high blood pressure. This is someone here who is in a situation of medication overload. I'll kind of reveal part of the story here because there is overtreatment, but and the side effects of adjustments have caused that, but she may not be thinking about that. So that's one portrait, one situation of describing medication overload. And then we'll get back to Fiona after. So really, we're going to get down to the practical part of our presentation. We've described, the issue with why we're concerned, what medication harm could mean in actual, examples, and what a risky medication is. But let's now really look at what we can do to reduce our exposure as a patient or, just as a society, how we can improve prescribing practices. So the first thing is really talking about deprescribing. Deprescribing, if you dissect, really is the opposite of prescribing. It either means reducing or stopping medication. It is always done in partnership with a health professional. It's really a combination. It's, of course, in the same way that when we prescribe products, it's done as a partnership. The goal is really to maintain or improve quality of life, and it's a strategy, right, to help either prevent in the best of ways, right? We would prevent or treat a person with medication overload. Now, how do we access deprescribing? That's, I suppose, the follow-up question. The best way to access deprescribing is in a preventive way, is to ask for a review of medications done, to identify those opportunities to deprescribe. To be frank, there are, patients where we deprescribe, but that's because if it's done, in an acute care situation, it's because we might have seen the examples before, they suffered a side effect and now they're really, in a situation where we do need to acutely deprescribe. But what we are aiming for is for this to be done before. And that patients stay on the meds they need at the dose they need. And there is a saying in general in pharmacy is really to use the medication at the lowest effective dose always, so that we reach our targets in terms of health and quality of life, and where the patient wants, what the patient is aiming for as well, what's important to them, while reducing the risk of harmful effects. So Fiona is, as I said, she's feeling dizzy. She had near falls. She is isolating herself. She needs a medication review. What are the steps towards a medication review? The first step to follow I didn't even mention, but these slides will be available after. Of course, the recording, but also the slides. So we'll share that. You don't, so if you want to refer to this after. The first step of obtaining a medication review is to obtain a list of your meds. Maybe this is something you already have, but an updated list of everything you are prescribed. And that is a good opportunity. So you ask your pharmacist to print this list. They can either usually print it on a 8.5 by 11 or a shorter, smaller version. 8.5 by 11 will help you to be able to, mark notes, add information, and review everything there. So you can tell your pharmacist, I'm not taking this anymore. Or, you can actually review and make sure this makes sense based on what you have at home. It'll also be an opportunity for you to identify and add any over-the-counter products, supplements, vitamins, or, products you're buying somewhere else, at another pharmacy, for example. And that's also part of the advice is to, purchase your medicine from one place so that the information is all found in one location. If it is not possible, then to be able to share this information between the pharmacies is key. Secondly, the next step is to use your list to review and question yourself. How is my medication affecting me? Am I having any issues with them? Or maybe there are no issues to flag, but there are, you're wondering, am I having dry mouth in the morning? Am I feeling dizzy? Things that are important to you, and just questioning yourself about your health goals and values. But also if you're taking care of someone, this could be a conversation you're having. And then asking yourself, if I were to prepare yourself in terms of if there was a recommendation that I stop one of these meds, would I be ready? How would I see this? Would I be open to this suggestion? And the step 3 of our, how to approach this practically speaking is also, we've provided questions. There's a lot. There's 5 here, and I know there were some more previously, but just to help you reflect, and you can prepare these questions ahead of your appointment with the health provider. So it helps you. You'll see question 3 is about memory falls, because we know these are issues that are high up on the end in terms of priorities. And then question 4 is like to the point. It's about asking about deprescribing. Can I stop or reduce the dose of a medication or this medication if you have one in mind specifically? And then follow-up is very important because we know that the follow-ups will play a big part into, making sure deprescribing is done safely. So really, it's just about working as a team and just showing that this collaborative care can only happen if someone who's an expert in their own lived experience, symptoms, health, meets with someone who has another expertise, the health provider. But nowhere in healthcare today are we seeing this as a the patient just receiving care without a say. So I know teachers are usually very good at being up to date. So, as I know perhaps I'm preaching to the choir here, but it's important for us. It's part of our message anyways in all our presentations. At this point, I see there's about a bit less than 15 minutes left. We do like to pause here and just reflect on possible barriers, worries, challenges that you may have or think of when you think about asking about deprescribing. If you want to reflect on what you could, either expect or would be concerned about, I'm happy to open the floor if someone wants to share, a personal concern. Let's just try to keep it a bit succinct so we're able to move through the last parts of the slides. Are there any concerns that anyone would like to share?
May I interrupt, Camille, and ask you maybe to try to finish up so that we could also look at some of the comments or questions in the chat?
Absolutely, absolutely.
Thank you.
So
Thank you.
we'll wrap up, and then it'll give us the opportunity to address the questions.
Thank you.
So I'll move forward and just describe, what we see in literature, what we see in our experience at the network. When we ask patients, what are your concerns? And just trying to provide some keys. So talking about time, issue with time is real. Healthcare providers are very busy. What if my healthcare professional doesn't have the time? Our advice here is that a medication review is something that needs to be planned. So it's about booking a special appointment to do just that, not asking it at the end of an appointment with a doctor. And we know that family doctors are perhaps in some cases not even available. In Ontario, I know there's this difficulty right now as well. I'm in Montreal, it's the same in Quebec. So what we want to put forward as well is asking your pharmacist. Their Meds Check program is available in Ontario, where there is support for, reassessing medications. It may not always be the right time because your pharmacist could be busy at this specific time. So calling in and saying, I'd like to have a med review done. I'd like to have a meds check. If you're on 3 or more meds, I think in 65 and above, that's valid. You can access a meds check program. It's covered by OHIP. And asking when it would be a good time to come by and, ask and conduct this med review. Changing a prescription from another provider is also a concern. So physicians sometimes aren't sure about why this prescription is there, what they can do about it. Our ask really is encouraging you to discuss it, and by sparking this question, either they can consult a specialist, but also consult externally if they're concerned about touching or affecting a prescription that's already on board. If a medication hasn't shown any side effect, is it really valid to deprescribe? Well, yes, of course. This is part of the whole message, is to, stop taking medications that aren't helping us. I mean, it's still money, it's still time that we're spending to take it, to go to the pharmacy and get it. So that's why we want to make sure it's still benefiting us and preventing, of course, before any other harmful effects or interactions happen. And I suppose one of the very important concerns, and is completely valuable, is what if my symptoms return when I stop my medication? That is absolutely something that we have to keep in mind. If we're reducing the dose of a high blood pressure medication because we're already taking 2 other ones, what we'll do is we'll have to put in place a plan. So the safe way to deprescribe is to have a follow-up. And if it does recur, if there is a plan in place to treat a return or aggravation, we will know and we will adjust accordingly. So just back to Fiona. Fiona was taking a medication for her diabetes that contributed to lowering her blood pressure excessively. And that led to her feeling dizzy. So after discussing and asking these questions, she was able to identify that that was the case, that she didn't think that a medication for her diabetes could lower her blood pressure, but it was the case. So by adjusting her 2 medication, one was stopped and one was reduced, they were able to stabilize her blood pressure, and she's being monitored for her blood glucose now to see how to address. But most importantly, she is back to her old self. She is able to resume her activities. So that is how a medication review can help adjust and help someone with their daily functioning, someone who may have, ignored these. So I'll skip over these because I do want to get to the questions. It's very important. And I see someone has their hand up too. Really to summarize that what we as a community want to, or organization really want to have you do after this presentation is encourage others to book this med review or book it with yourself with a health provider, either your pharmacist, as I mentioned, or family physician or nurse practitioner. And share resources that I will present briefly and spread the word about this. Before we go to questions, I want to have the opportunity. Nadine is going to put this link in the chat. This is a survey to assess this presentation. So how you feel about the information that was provided and how we can improve it. So if you have just about 2 or 3 minutes, it would be so useful for us to collect your input, your feedback. So we'd be really grateful if you took the time. And I will be also very happy to take questions now. So I'll pass it over to Anna.
Thank you, Camille. I'll go through the chat first, and then we could take any other questions. So someone asked if you could touch on antihistamines, and you did that. And there was someone who thanked you for bringing up the issue of sleeping pills. They were wondering if when you are advised to take a new medication, should a senior routinely ask both the prescriber and the pharmacist about the safety and the efficacy? And I think that you have also addressed that point in your presentation.
I would say,
Sleep.
yeah, absolutely. There's no harm in asking more than one source, especially it's your right to ask, and making sure that we know that, we're provided with a lot of information at once in a pharmacy and just what we can retain. So even if it's just repeated, it's good because it helps us, actually integrate the information.
Perfect. And there were a couple of questions about sleep apnea and the use of CPAP machines. I don't know if there's something that you could comment on for that.
Yeah, CPAP machines are, as I see a comment from Mervyn, are life-saving. Absolutely. They help ensure that your brain keeps oxygenating during sleep. And there are medicines that are not recommended for sleep apnea. I don't want to go into too many details, but it's always good to ask as well. But absolutely, I could not diminish the importance of identifying sleep apnea, meaning you are woken up and maybe some Mervyn coming forward with his story, if you want to describe how you felt with sleep apnea, but feeling really tired the day and waking up constantly at night, but perhaps not necessarily recognizing it. So the consequences are real on health. And these machines are essential. And of course, that can be identified falsely as insomnia. And sleeping pills are generally to avoid in sleep apnea. So that's why CPAP really is a solution if we have sleep apnea.
Okay. And we also have someone here who is asking, should we ensure that we keep lean so that the medications don't linger in our body? So
Well,
our weight.
I would say, I would look at it more in a broader way. I'd say that the impact of just maintaining a healthy, like a valuable muscle mass is more important just because of it prevents falls. It ensures that we're able to bounce back off if we ever have near falls or things like these. So sarcopenia, which I can write in the chat here, is the fact that we have our muscle mass is kind of slim too much with time. Is more about that than the actual fat content of the body that I would put forward. So maintaining being active and maintaining a good muscle mass, a sufficient muscle mass is rather what I would say.
And then there was another comment about the fact that in some cultures, people fast, and would this be able to give the body a break?
Yeah, I mean, there's a lot of conversations about those diets 16-8 and all of that. I'm not a nutritionist, so I'm not really well versed enough to recommend or not. There's literature on it about its impact on patients who have, diabetes, etc. So, but in an absolute way, it's just about encouraging a healthy diet, and we can look at different ways for people to adhere to that. But I'm not a nutritionist, so I don't want to go too much into recommending a diet as well. Yeah.
If we use multiple community pharmacies, what's the mechanism to ensure that each of us has a total medication list?
Yeah, that would rely really on you making sure that when you go to this other pharmacy, you bring your list and that they are able to integrate it specifically in the computer. I'm sorry, but I'm not necessarily 100% sure if Ontario has please ask your pharmacist if they have access to a unified database with all pharmacies. I'm not up to date on that because in Quebec, it's the case. So a pharmacist can look and know what you're on somewhere else. But I wouldn't want to say that it's the case in Ontario if it's not, but it's possible. So please ask them. So they should be able to access it if that's the case, to look at all medications you're on. If anyone wants to fill in here and knows, please do in the chat.
Often when receiving medications or prescriptions, pharmacies switch generic medications for the actual original medication that was prescribed. How do they have the same quality and effectiveness?
Yes. Yes,
Okay.
there are absolutely no concerns with generics, apart for very specific conditions. I don't want to go, but things like bipolar medications, anti-epileptic medications that require very specific blood level concentrations, but for the vast majority of medications, generics are safe. And we see this as a way to ensure that more people can access medications. If we all stay on originals and pay the price, and likely the access would be much less, would be much reduced.
Okay. There's quite a few positive comments about the getting a list of medications and the value of that. So thank you very much for that. And someone has suggested that having this compiled list of prescriptions and over-the-counter products is an important wallet enclosure. The fact that you have a copy of that on your person, should there ever be a medical emergency of any kind.
Absolutely.
And then the Survey Monkey, Monkey survey link is here. And then the last one is, what is the role of the pharmacist in regards to the use of supplements?
So the
I don't
pharmacist
comment on that.
is, I mean, when you're in a pharmacy and they're selling this product, you should be able to ask questions about this product to the pharmacist, and even further if you're taking supplements. So do ask your pharmacist if there are possible interactions between your supplements and a medicine. If it is something that is less common, because there's a lot of them, I'm not going to lie, natural products is a huge, there's number of products, and they may not know off the tip of their fingers everything that exists. They will do the research, and as a diligent pharmacist, I would take this as, okay, this product I've never heard of, we don't sell it, it comes from somewhere else. I'll do research and follow up with you. So that is a responsibility of your pharmacist. Yes.
Okay,
Please
so
ask.
we are just a minute or two over, but we have two questions I'd like to get to. The first one is Harvey. So Harvey, would you unmute, please, and ask your question?
Yeah, I don't have any
Yes, I
meetings
think
now,
that-
so I'm happy to stick around just a couple minutes. Yeah, for sure.
Right.
Thank you.
Can you hear me?
Yes.
Yes. I want to thank you for your presentation. It was extremely informative. My comment is in terms of your physician, because my wife and I have different physicians. My physician really keeps a pretty good record of my meds, and is very careful. My wife's physician seems to prescribe. We get the impression that she prescribes to become more efficient as a practitioner. In other words, to get the patient out as quickly as possible. The other comment that I'd like to make is that having a very good relationship with a pharmacist. We've had our pharmacist for 18 years, and she has a number of times picked up on the fact that the meds that I'm taking should not be, in other words, she's picked up an error that the doctor has made in prescribing a medication that will contradict another medication that I'm on, and she's contacted the doctor to change the meds. So having that relationship with the pharmacist, with one pharmacist, I think is incredibly important.
Thank you so much. These are two excellent points. I'd say, yeah, I should have said that. You bring a big gap. Yes, not only sticking with a pharmacist, but also developing that relationship. And if the service is, if you're not getting those answers, really, looking at the way that you're receiving your medications is also, like, in terms of selecting your pharmacy as well, is important. And then
Thank you.
your point about the lack of time, like the fact that unfortunately it can be seen as a way to end the appointment to give a prescription. Yes, it is a real barrier, and we recognize that. So if we're able to ask, is there something else I could do, rather than, if there's a medication, okay, are there other options in terms of asking? But of course, we recognize this is a real barrier.
Thank you. And our last question before we end off, because we have people who need to leave for an executive meeting, is
Cool.
Lenore. Lenore, would you please unmute yourself and ask your question?
Yes, thank you. Can you hear me, Anna? Yes?
Yes,
All right, fine.
yes. nice
So
and
Harvey's
clear.
comment was an excellent segue to mine. I had actually put the question in chat asking our doctor and our pharmacist if there's a new medication being prescribed. But the rest of my question, which wasn't read out, was really the crux of it. And that was, who do you trust if they don't agree? Doctors have so many things they have to keep up with these days. How up to date are they on the newest meds, the side effects of those meds, the research on those meds, the interaction of those meds versus the pharmacist? Who do you trust?
I'd say it's really a case by case. The pharmacist is the expert in terms of the product of pharmaceuticals. It's what they do every day. Doctors are experts in diagnoses and, of course, treatment, but pharmacists will definitely come into play in terms of looking at product and latest up to date information. So it's hard to generalize, but each has their own focus and complement well. So as much as if you're looking to get a confirmation on a diagnosis, but also looking at when we look at the treatment, I think, yeah, we would be it would be sad not to ask the pharmacist for their opinion, considering their expertise, of course.
Okay, thank you very much. I think that's it for now. And there is an additional possibility that if you have a medication-related experience and would like to share your story, you can click on the link that's provided in the chat and you could do so. I'm just going to ask very quickly, Sylvia, are you still with us or have you departed for the other meeting?
Yes, I am with you because I've been finding this information very helpful.
All
I would
right, so
like to
go-
thank you
go
on
ahead.
behalf of District 23 for this interesting presentation. Many of us at this stage in our life are taking medications, and your suggestions and advice is very helpful. I know that I've learned a lot, especially around how many people are taking medication and how it affects our body when we get older. So I'm delighted that we recorded it so that I can watch it again and learn more. So thank you again for this presentation.
Thank you,
Thanks,
Sylvia.
everyone.
Thank you, Camille and Nadine, for helping out. We really appreciate it. And we look forward to seeing you in the future, maybe with additional questions and additional presentations. It's been wonderful to work with you over the last couple of months and to be able to finally bring this to fruition. I'm going to ask everyone, please, to leave the session, and I'll just speak to Camille for a moment afterwards.
Thanks, everyone.
Thank you.